Well, we are 3 minutes into the hour, so why don't we go ahead and get started? Hello again, my name is Bill Sappenfield. I have the pleasure of being the director of the Florida Perinatal Quality Collaborative. And today we want to talk about your second chance to become part of this program. The legislature, again, has given us 1 year's worth of funding to support hospitals being verified for levels of maternal care. We're doing this in partnership with the Joint Commission and ACOG. And we want to tell you all about this and the great opportunity for you and your hospital. Next slide, Sarah. For those who are not aware, ACOG published with the Society for Maternal Fetal Medicine their joint consensus document on levels of maternal care. They updated that in 2019. They did their own national pilot of a few hospitals to verify the guidelines were workable and appropriate. And so they are now out and in use across the country. Next slide. Next slide.
Sorry, the slides aren't working for me right now. I'm gonna keep. Okay. There it went.
As part of that, the idea is we want all hospitals to be verified for obstetrical levels of care to make sure they meet national standards, but they do break it out by levels of care: level 1, basic care; level 2, specialty care; level 3, subspecialty care; and level 4, regional perinatal healthcare centers. And the idea here is to help in Florida create a risk-appropriate system of care within hospital networks and across the state so that mom's care can meet the risk that she has. Next slide. Why levels of care? Why is the legislature funding this? One, we're trying to do it to reduce our maternal morbidity, mortality. Our mortality and morbidity both continue to go up. And this is one of the recommended evidence-based strategies to try and improve that. Again, we want to encourage a strong risk-appropriate care so moms are managed at hospitals, because in our fetal infant mortality review committee, we continue to find mothers who are delivered by providers at hospitals that are not well prepared for the level of risk of that mother. So we want to ensure there's a consultation and referral system in that system of care. We also want to make sure that we provide outreach training and support to help those hospitals over time. And the idea is if we can verify and standardize our system of care, we may also be able to improve the perinatal care or the perinatal outcomes for all populations. Next slide. What's nice about the program is these are the fees for the Joint Commission. Shows you the annual fee, the on-site fee, and the total 3-year fee combined. As part of this program, if your hospital participates, if you're a level 1 and apply as a level 1, FPQC will pay all 3 years of your fee. You'll have to pay nothing. If you're a level 2 or higher, we will pay your first year annual fee and your site visit fee, which is almost half of the cost of being verified for the level of care you are. So this is a great investment by the state to encourage you and incentivize you and your hospital to apply. Next slide. What do you have to do to get it? Again, you've got to commit to paying the 2nd and 3rd year verification fees for the Joint Commission. We'll pay year 1, but after that, you need to do the next 2. We prefer that you schedule your site visit day within about 90 days of completing your Joint Commission application. What really is important for us is we really want you to have your the expected day to be no later than April 1st so that we can do it within this state fiscal year. We would like and require you to complete an online verification evaluation, because we want to make sure that this program works for you and other hospitals. So we evaluate it on an ongoing basis. This last year, the hospital evaluations were very positive by all hospitals. We do want you to acknowledge that the Joint Commission has an automated billing practice. So you're going to get billed by the Joint Commission as soon as you apply. And we encourage you and your billing office to ignore it. The Joint Commission knows that FPQC will pay and that it will take time, but their system will keep reminding you. We also want you to acknowledge that the Joint Commission will keep FPQC informed of the level that you apply at and what level you're verified at, and that we'll be sharing that information as part of our funding with the Department of Health, making it public information. Next slide. We do want to acknowledge our 13 leaders in the state who stepped up in this first year and got verified. As you can see, they crossed all 4 years. The most amazing thing about this is they were all positive, and almost immediately the #1 recommendation is they want to sign up to be a peer technical assistant network for hospitals who want to apply and do this. So we actually have people who did this with boots on the ground who automatically want to help you and your hospital complete this process if you're interested. Again, a salute to the 13 hospitals who stepped up and now meet national standards. Next slide. So Betsy, is this where I turn it to you?
Nope, this goes to Brian.
This is next steps for us. So this is on our slides. So one, we want you to go ahead. We want you to go ahead and look at our Level Care website. Please review over our website. We have the application there. We describe the program. We show you how you get in contact with us. We'll talk about your steps. And we're soon going to have a playbook and other information that Betsy's going to talk about later. With that, I want to introduce you to our partner, Brian Johnson, and the Joint Commission. They've been an outstanding partner this first year, and we're going to continue to work with them over the next year. Brian, let me turn it over to you.
Thank you, Bill. I appreciate it, and welcome everybody. It's a pleasure to be with you. One of the things we really wanted to make sure we did in this partnership is to demystify the application process and make it less scary for you all. So there's a lot of resources out. You guys have already done really amazing work. And we just want to be a part of making sure that you have a great experience. So I'm going to talk a little bit about the application process and some resources that you have. So let's go to the next slide. So if I could sum this up, it'd probably be in a couple of steps. There are always steps, right? But in 4 steps, really, these are the things that we're going to talk about today. Step 1 would really be getting access to the standards if you guys haven't already looked at those. And then doing a gap analysis. You can request the standards using this email address at certification@jointcommission.org. We're going to be asking for providers to help us understand what clinical practice guidelines you're currently following. We'll talk a little bit about that and developing a performance improvement plan. Then we want to make sure you got access to the application. So I'll show you a little bit about what that looks like. And then there's a review process guide to really kind of help you understand what's going to happen once you get on site. Next slide. So these are the access to the standards. This is step 1. If you don't have those, we update these and make sure that they're updated. So it's always good to get the latest version for us. Occasionally there'll be some changes, but you're definitely going to get notification. You can share these with us. This is the e-edition version that you're looking at. You can share these with colleagues. Again, if you don't have access to these, you might want to get with your colleague or a regulatory colleague at your hospital. If you're a DNV hospital, that's okay. We can make sure you get access to those standards as well. So we want to make sure that you understand what the scope of the program is, and it defines these in our standards and do a gap analysis. Next slide. Step 2 is really about understanding these clinical practice guidelines. And what we've done here is listed several of these you may already be using, but these are some of the clinical practice guidelines that some of the organizations who've already completed verification are most widely using. There isn't a absolute minimum, but there certainly is a point for which you are practicing and providing care for others. So this is something that we asked you for in your application. Again, this is a list of those clinical practice guidelines. So certainly someone on your interdisciplinary team would be looking at these and evaluating these. Most of these are coming from our partners at ACOG, but occasionally we'll have something from AWAN or another organization. but we wanted to just make sure you had these clinical practice guidelines. So we'll ask you for those in the application. Next slide. The performance improvement plan is another thing that the Joint Commission really, as a improvement organization, we're all improving, even internally at the Joint Commission. We're always improving. That's something that we can always take pride in doing. We are not expecting perfection. We're just expecting that an organization has something that they're working on and is looking forward to sharing that with us. There are 5 questions that we typically ask in the application. As you can see here, the first one really is about your scope. And in your scope, you're working in the state of Florida on a perinatal collaborative. So you can mention that. This is really a 50,000-foot view of what your program is doing, what clinical practice guidelines you're following, and just kind of how long your program may have been in operation. So you can brag on yourself about that. The second question really identifies your interdisciplinary team, who's working with you to provide care, mother, baby, delivery, obstetrics, gynecology, all of the folks who were involved with being on your team. The third question is about what goals and objectives do you have as an organization, and how are you putting those plans into place? Specifically, maybe in question 4, we asked organizations to really try to think about benchmarking. If you're at 30% and you want to be at 80, that's a goal. And we want to kind of understand what you're doing as an organization to try to get there. And it's certainly a great time to talk to our reviewers about what their experience has been and moving them along. So you're not doing this alone. You're really getting feedback and getting best practices from our reviewers, and certainly sharing some of your successes. The last question is really about accountability, and where do these performance improvement goals go? How well are you doing? How can you get executive leadership and sponsorship around the program? We all know that maternal levels of care and maternity health, mother and baby outcomes can be better in the US, and that's why we're here. You're doing a great job if you're certainly looking at this program. And so we just want to ask, who is responsible for initiating that kind of response, and what's going on with those measures. Next slide. And this is the just a picture of what it looks like to have access to the Joint Commission Connect site. This is where the application lives. It's really in 2 parts. This part is really getting into the application. My job is to make sure you have access to this. One of the things we're going to ask you is, when do you think you're ready? Typically, we ask organizations to apply 4 to 6 months before they'd like us to come on site. But this is what we're going to give you access to. The application is housed here. You'll put your clinical practice guidelines and a number of other things in this application, and we'll walk you through that process. It usually takes a couple of times to kind of go through it and add your information, but it's really not that complicated. So I just wanted to demystify that and give you a sneak peek of what that kind of looks like. Again, if you don't have access to this, we can work with your quality and regulatory colleagues to make sure you have access. So we'll talk about how to do that in a later time. Let's go to the next slide. One of the other things that's pretty important to kind of understand what an organization is doing is really to kind of understand where you are with respect to your volumes. You're going to put inside what kind of level of care you're applying for, and what's the capacity that you currently have to take care of mom and baby. So as you can see here, we're asking you about the different types of units and beds an organization may have at their particular locations or sites. We need to go back one. And we really want to make sure that we understand your volume. So we usually try to do a 12-month rolling volume. If you can you go back maybe one more slide? So just wanted to give you a sneak peek of this. Thank you so much, of what this is, and whether you have dedicated ORs or in your capacity to get to others that may not be dedicated, just in case. So this is just a sneak peek of this. You'll have these slides. This is something that we usually ask for. So in preparation for preparing for the application, this is something that you can think about having. So you'll have these slides, I'm sure, afterwards, and you can begin to kind of prepare this information. All right, next slide. Now that you've completed the application, we'll get you over to our scheduling team, and they'll get you scheduled and the great folks that we're working with, Bill and Betsy and Lori and team will join you on some of these reviews. But now it's time to kind of plan for what's that on-site review look like. We don't want you to be nervous. We'll give you a lot of information, but there's a review process guide you can use here just to make sure you understand what the expectation is when we come on site. It'll give you the opening conference, what's in the agenda, who needs to be there, kind of what's going on and what the expectations will be. The great thing is you've got 13 other colleagues around the state who have done this. And so I know they're going to talk about maybe how to reach out to them, and you'll probably hear from some of them right after me. But just another great resource for you to have. And sometimes I can kind of look in and see what others are doing and connect you with other hospitals as well that may even be outside of the state. So you got a ton of great resources here. So I want to make sure you guys have access to this as you prepare for that on-site review. Next slide, please. We are delighted to have some great colleagues of yours who work in the perinatal obstetrics and gynecology space. Their job is to inspire you to share best practices. You are supposed to brag on yourselves and what great work that you're already doing. And their job is really to kind of be that conduit with best practices. So if there's something that you guys are working on in your performance improvement plans, you're not supposed to try to struggle alone. You're supposed to maybe make sure that we're talking to one another and we're trying to get from A to Z as fast as possible when it comes to improvements. And so they're there to be that conduit for us. So please use them as a resource as you're engaging with them as they're coming out on site. Again, these are your colleagues. We put them through a great deal of training, and so they're very versed in looking at programs and in particular this mother and baby and our perinatal advanced program as well. Next slide, please. As you're going on site, sometimes it may be a difference. Usually the obstetric gynecology or women's health departments in hospitals may not have familiarity with certification, but we usually follow a disease-specific care model. As I mentioned before, many of your hospitals already have a stroke program that they have in-house. So they are some great colleagues who can be a great resource to you, and they can certainly help you understand what happens with the tracer methodology. It's the methodology that we use to trace patients when we come on site to kind of see where you're at. Usually they'll ask for some open and closed cases to talk to patients, to see kind of the level of care that you've been providing. At this point, they'll usually ask for the credentials of those who may have been provided care during one of these tracers, and they're going through your EHR, looking at your order sets and clinical practice guidelines. So you're right there, you know all about how that's going to happen, and we share that with you in this methodology. During the closing conference, you're going to know exactly really where you are as an organization. We've had some great success with the 13 organizations who have been verified. And so you're going to know right away if there's something that there was a gap and you can fix it, and you certainly can. You have 60 days of evidence, we call it evidence of standards compliance, to basically write back to us on how you will improve or fill the gap in that analysis. So for the most part, most of everybody is getting verified. And so this is a great thing that we have. Again, this is not punitive. This is a really, really great opportunity for you as an organization to be verified. So if you can go to the next slide. Just to reiterate again, because we know repetition is how human behavior works, I want to make sure that you understand you got to get those standards. If you don't have access, to reach out. In that application process, again, we're going to be looking for your clinical practice guidelines, that PI plan, and your ready date. And then the other thing that we do for organizations is we give you the opportunity to have blackout dates or a void date. So if someone's going on vacation, significant members of your team might be out, you can give us those and we will not come to your site during those days. Typically these reviews are 1 or 2 days, so we can work around that, and the team is really flexible. You don't need any data to put in the application at the time of application. And once we do this, we're going to give you 30 days notice. So it's not going to be any surprises. So this isn't a aha, gotcha. This is very different feel from the accreditation model. We want you to do well. We're going to let you know when we're coming. So we're going to give you 30 days notice so your team can understand what's going on. And as I mentioned before, typically we usually ask for about 4 months of maybe what you've been doing in your plans. And so we want to make sure that you have something that you're doing with that. This probably isn't the time to try to recreate the wheel and say you're measuring something that you haven't been measuring. Just do what you've already been working on and continue to improve on that. And after this, if you see something, there's something that you want to measure that you haven't been measuring, and you talk to one of your colleagues who comes out and does the review, then maybe you want to look at it then. But don't try to recreate the wheel in advance of us coming. Yeah, I know you've got some initiatives that you're already working on. We really would love to hear what those are. And then I briefly wanted to just mention, if you, for level 1s and level 2s, that's usually a 1-day, 1 reviewer. In addition to your colleagues from the Perinatal Collaborative will come out and join as an observer. If you're level 3 and level 4, that's usually a 2-day, but 1 reviewer. So those are kind of the steps to the application process. Next slide, please. So wanted to just make sure that you had that, reiterate, feel free to reach out. We have a ton of resources for you. Really excited about you all being here and considering this program. I'm looking forward to working with you. I am your contact for the state of Florida. I take care of many of the other certifications as well, but this is a huge priority for the Joint Commission, and we're delighted to have the Florida Perinatal Collaborative as our partners in ACOG. My contact information is here, and I'm delighted to talk to you. Looking forward to scheduling some time with you to figure out where you are in your journey and how we can support you. At this point, I will turn it back over to Betsy if there aren't any questions. So thank you very much for your time.
Hi, thank you, Brian, and I want to welcome you also. I am really excited. We've got 3 nurses, as Bill said, who have been through this process, who are just going to give you some insights into kind of what it was like. We've got, I want to welcome Colleen Rodriguez. She's the Assistant Vice President of Nursing in the South Miami Hospital. Nadine Walker is with Advent Health. She's Executive Director of Women's Services in the Central Florida Division South Region. And then we have Nancy Travis. Nancy is the Director of Women's and Neonatal Services in Lee Health, in the Cape Coral Hospital. So Nadine mentioned that she may have to get off. So Nadine, why don't you start us?
Thank you, Betsy. I just want to share, a couple of insights. So we decided to apply because we're highly focused on quality improvement and patient safety, like all of you. And we wanted to make sure that we were actually providing the level of care that we thought we were. So it was really a great opportunity to review our systems, processes, workflows, and just make sure that we truly were meeting that level of care for the facility. And we actually we verified 4 facilities in 1 week. 1 of them was a level 4 and 3 of them were a level 2. And we did a level 1 in an additional week. So we had a variety of things that we were looking at, since there were some different requirements for each hospital. But as a network too, we wanted to make sure that we understood where everyone was, and we were, like I said, meeting the quality of care that we thought we were. When I presented the idea to my executive team, they were all in, again, because it's all about quality, safety, making sure that we are meeting the needs of the women who seek care through our doors, and having all of the resources that we need to meet the level of care that they need, actually. And I would say some of the learnings that really helped make it easier, kind of the second round, so to speak, when we did our Heart of Florida Hospital, was that multidisciplinary approach from the beginning is key. Connecting with your ED, lab, ultrasound, respiratory, and really making sure that you're all on the same page, everyone understands the workflows, and that your systems and processes are working. Because OB can't do this by themselves. It takes a village, right? So everything is looked at during the survey, and having those leaders at the beginning as part of the process, I think, was a key learning for us. That was really, really important. And I would say, it's really made a difference across our system in that, not only do we feel confident in the care that we're providing? Our teams are very proud of it, but it's also given us ideas and things that we can do better. Our surveyor was amazing. She shared a lot of information and best practices and ways that we could improve things that we were already doing well, but things she had seen in other places. So overall, I would say it's an amazing learning experience, and I highly recommend it. And I'm more than happy to talk with anybody who needs some help or guidance if they decide to go through the process.
Thank you, Nadine. And yes, Nadine is one of our coaches that is available for consultation. Colleen, would you like to go next?
Hi, yes. I was going to say that I think for our hospital, we had seen the verification when it first came out and we're looking at it, but when FPQC was looking at it as well, it helped to propel us to go for it. We have been a Joint Commission certification with preterm labor and prematurity, and those were both sunset at the end of the year. So we were looking for something to help us continue the quality that we have in these services. So it's sort of lined up. And again, like Nadine, my CNO, CEO, and even CMO were all on board as soon as we presented it, with us going for the quality and supporting us. The tips, I think, for success are divide and conquer, plan ahead, and practice. Practice your sessions before the person, the surveyor's there. Plan a day in practice. Have someone from your QI department come and be a surveyor. And involve the whole hospital and the board, and treat like a regular Joint Commission accreditation. If you usually have scribes, if you usually have people calling ahead, use all those people to your benefit for your verification survey. Again, like Nadine said, involve all the other departments and involve them early. The other thing I would say is your opening presentation is your time to shine. Put all your cards on the table. Put all the best practices up there. Put as much as you can. You have a full hour. Don't make the reviewer dig for it. Put it all out there and have it. It's your time to shine. So it's sort of more of a like a magnet, if you're a magnet thing, to show your best practices, even things you do in the community. And then my other advice, and I'm willing, like Nadine, and Nadine was who helped me out. She went like 2 weeks before we went, and we reached out to say, what was it like? And when we reached out, they were very honest about like, what were the things that surprised you in the survey? And one of the first things she said is the first place they went was our main ED. And we said, the main ED? That wasn't on the list. The same thing happened when we got here. The first department they went to wasn't OB-ED, it was the main ED. So those little tips helped us to be ready for what we experienced that day. And I think it made huge team cohesion, and the hospital here is a whole hospital verification to celebrate the excellence. And they also helped us to recognize best practices that we had that we didn't realize weren't other places, like our Code Crimson. So I think that's what I would say.
Great. Thank you, Colleen. Now we have Nancy Travis from Cape Coral.
Okay, well, I will say ditto to what the other two ladies said. This process was opened up to us and we were excited about it. So we decided to take it to our administration and ask. We are not a Joint Commission hospital. We do use DNV for our accreditation body. So there was a little bit of hesitancy there just for a minute till I was able to explain what the process was and why this was important for the state of Florida. After that was there, when we said we were working to decrease maternal morbidity and mortality around the state, they were on board right away. And the process with Joint Commission, being a DNV hospital, was very, very easy. So they got me a password. I was able to go in and work through the whole process very easily. So it was very fun. I would say that with our group, the Lonely 13 that went first, we connected somehow. I don't even know how we connected, but we did connect, probably just from our A1 colleagues across the state, and we asked each other questions. So we were helping each other even before the FPQC had this helping group, and we decided from that we are going to go ahead and help others as they go through it. And we were strong and asking for that. The tips for success, I would say, like Colleen said, show off. That first meeting, we had everybody, all of our ancillary partners came to the table. We had a presentation ready to go. We spotlighted all the work that we've done with FPQC because we've been with FPQC from the beginning. So all the initiatives that we have participated in and how they were working then, and then what we were working on right at the present time. The surveyor was great, very engaging with the staff. He went to us fetal monitoring strip huddle. The staff was able to tell him about what was going on with their patients. He did interview a patient, and that went very, very well. Absolutely no problems. The nurses, because we've been working so hard with our labor support and doing different things to decrease our C-section rate, they told them about how they dance with the patients. And he said, "You're not going to get me to dance, but you know what? My team got him to dance by the end of the day." So it was really fun. It was a fun day. The providers were very engaged. I think the best part of it is just how we were able to shine and how we have confidence that the care we're providing is good care. We're doing the very best for women and babies in our community, and it has been a morale booster for our team and our providers.
Thank you, Nancy. I know Nadine may not be here, but Colleen and Nancy, are you going to be here at the end for questions? Okay.
Yes.
Okay, then we will move on. Next slide. I'm Betsy Wood. I didn't introduce myself earlier. I am the nursing consultant for the Levels of Maternal Care program. Next slide. So we have developed a playbook, and this playbook has been developed really basically using the comments from the 13 hospitals that have been through the process. And thank you. These guys have been so forthcoming and helpful in giving us comments, saying what would have helped them. And we've done that. By doing that, we even named it a playbook. That was I think a suggestion from a colleague, rather than what we usually call it. Anyway, so we have kind of 5 chapters, so to speak. And it takes you through, the playbook takes you through, it's broken into sections. It walks you through the entire process, really step by step. Talks first about what you should consider if you're thinking about going for maternal levels of care. It talks about ways, how you should prepare for it, kind of in detail, about getting your teams together, about suggestions on how often that you can be there. I mean, how often you need to meet. Then we talk about the actual application process coming in, both the FPQC application, which is a funding application. There's 2 steps to it. You need to apply to FPQC to get the funding reserved for your hospital to go through the process, and then also the Joint Commission application. We've got tips about it being the actual site visit, and then more information about after the site visit. Next step, next slide. So we have PowerPoint presentations that are customizable. We've also got suggestions or examples of the opening meeting PowerPoint presentations, and kind of how you can put it together to make your hospital shine. Next slide. We have checklists. I would recommend looking at that quick start checklist, because we want to remind you that and help you be sure that all of the steps that need to be taken and all the considerations are front and center, so that you're sure that you're ready and have really prepared for the whole process. Next slide. We snagged some educational materials, both for educating your staff, your executive committee, your department about what levels of maternal care is, why you should do it. And then also kind of some rah-rah, some things that you could post to get enthusiasm for the site visit as well. Next slide. And the one that I think one of the most helpful is a advice from your colleagues, including actual quotes from the colleagues. That this came mostly from our evaluation, which is another reason why we asked for you to participate in the evaluation, because this is an ongoing document, and all of the folks that have supported, have created, have gone through the evaluation, as Bill said, they also are willing to do one-on-one mentoring, discussions, collaborations with the new hospitals. Next slide. So as Bill said, just the next steps, if you'll go to the FPQC Levels of Maternal Care website, look at the things that are available. The next step would be, when your hospital decides to do this, go ahead and submit the funding application. Even though you're not ready to apply with the Joint Commission yet, go ahead and submit the funding application so that we can have the funding secured for your hospital. Talk to your colleagues. We have a list. We can get you in touch with your colleagues, and they're available more than once as well. Submit the Joint Commission application, and please contact us and the Joint Commission anytime throughout the process. We are here. Your fellow hospitals are here to help elevate Florida and get as many hospitals verified as possible in the next year. Bill.
Well, I thank our special presenters today. I appreciate Colleen and Nadine and Nancy and taking the time to do this. Again, we try to bring people here to make it real. When we say this is a positive experience, it's not like accreditation. This is a chance to shine, but it's also a chance to talk through with a colleague how your systems are working. I mean, they will identify the things that have nothing to do with your levels of care that you can work on that might be of help. Everyone has considered this positive. So we just want to answer your questions. Now, one of the questions that came up, Brian, we need your help with. They want to apply for your perinatal certificate at the same time to do the levels of maternal care. And is that possible?
Thank you, Bill. Yes. So it depends on when their renewal date is, or when they're trying to do that. It could be worked out where the same team, because these are usually the colleagues that are reviewing that program, could also be there to do both of those. It depends on the level. Like we mentioned before, if you're going for a level 3 or 4, it may just add an additional day, but we can certainly look to see if we can kind of coordinate for you, since this is announced, it's not a surprise, and certainly reach out to us to see if we can work on kind of coordinating that for you all.
But to be clear, you really do need to go through the process for both of them. So there's no work reduction in terms of trying to do them both at the same time. They each have their own levels of things that you need to do. So if one is a lot of work, two may be doubly a lot of work.
Yes, that, I would advise that, if only if you have a recertification that you're trying to do, I would say, it probably is best to try to do those at one time. Now, we all know that resources are slim. And so for the most part, your leadership team, some of the same teams and interdisciplinary teams who are involved in the maternal levels of care may be the same ones who are involved in the advanced perinatal certification. So, that's an individual choice. Again, we would definitely try to work with you, but as Bill mentioned, the requirements for each one of those programs are certainly different, and there are some different expectations that you will need to meet, which is why they would do them on separate days and not combine them.
Other questions? If you request level 4, but that you visit your level 3, do we need to apply?
And who was that question for?
If you request level 4 and you don't make your level, Karen, you can go ahead and be verified as a level 3. And also they do give you 60 days to try and correct or adjust anything that's found so that you could reach the higher level. The idea is they want you to make as high a level as you are able to, and they want to give you the time in which to do that. But you can choose to be verified at that level. My understanding, Brian, too, at that day, on the day of the site visit, you could withdraw your application, just wouldn't withdraw it in general, correct?
Yes, and I think Jennifer, my colleague, said she has a response for that too. She's been on many of these reviews and is part of our standards team, who could give us some insight into that. Jennifer, are you on?
I am on, thank you. What would happen in that situation if you were applying for a level and say the surveyor says, you know, you need X, Y, and Z in place to be a level 4? If it's something that you think that you can accomplish within the 60 days that you have for your evidence of standards compliance, then we would continue the review as if you were going for a level 4. You would just have to submit your evidence that you were able to complete X, Y, and Z, and then you could be awarded as level 4. Now, say it's something that's difficult that you probably cannot complete in 60 days, then there's 2 options. We would call central office and we could say, you know, we're going to turn this into an educational visit. And so that gives you more time to get what you need in place to accomplish that level 4, or we could roll you back to the level 3 that you would meet, and then we would verify you as a level 3. So it's kind of a 3 option process. You can submit your ESC, get your level 4. We can turn the visit into an educational visit while you get those pieces in place so that you can apply for a level 4, or we roll you back to the level 3 that you're already meeting, and then we would verify you as a level 3. So hopefully that makes sense. Happy to answer more questions about that as if they come up.
Thank you,
Jennifer, thanks for
Jennifer.
being on the call and helping to answer the question. That's great.
Sure, of course.
Other questions? Again, I just want to emphasize this is one-time money, so this is really your second chance. Again, if you're level 1, we'll pay all your fees for you to do this. And if you're level 2 through 4, we pay almost half of your fees. So this is a great opportunity to get verified, but most importantly for us, our goal is to help improve the quality of care for moms and babies and to help address our maternal mortality and morbidity problem that we're continuing to have. Our playbook will be accessible as soon as it's complete. It will be up on our website in direct access to anybody at all times, just like all of our FPQC materials. If you do want to reach out to our peer network, though, I would encourage you to reach out to Betsy, or you can reach out to fpqc@usf.edu. You can always do that and we'll get it to the right person. And then we'll share that information directly. We don't usually post people's information on the website. But again, guys, I sat through one of the visits and the suggestion checklist was incredible. And the visit I sat in contributed to that suggestion list. I think it'd be very powerful in helping you, and it makes it more doable and more real. Because I think the biggest fear that I saw when I went on my visit, when the day started, was fear in the eyes of the hospital. And by the end of the day, there was nothing but smiles and celebration across their face. And that was even before the reviewer said what level they were. So we want to change that fear of the unknown to helping it be a known commodity and a known positive process where you can contribute to your patients and make a difference. Any other questions, closing comments?
Yeah, I think that's a great comment. Again, this is definitely, and we heard our colleagues Nancy and Colleen talk about, their experiences. And I used to say, hey, if I'm showing up, it's the love of God, it's not the fear of God. So, hey, that's usually what we're trying to do. This is a great experience. I was wondering if Colleen, maybe Nancy would mind sharing were there any focuses on the handoffs, if you will, and kind of the thresholds for those as you kind of looked at your kind of levels of care and what you guys had in place? Would one of you all mind speaking to that?
I mean, handoffs from one hospital to another.
Yes.
That was a focus. We are a level 2 hospital. We typically transfer to our own internal hospital. So we have a hospital about 12 miles away that has our NICU at it. And we typically will transfer mothers to there, but we often will transfer also to Sarasota or other places if they are full. So that was asked, and we do have a policy on how we do. We have a maternal transport team that comes and picks the mothers up at our hospital and takes them to the other hospital for care as we need to go to a higher level of care. So that was done. We had some great statistics from our maternal transport team that we were able to share to show how many patients had actually gone and the reasons for their transfer.
And I think I can speak to that as well. That was something we included, I believe, in our opening presentation, is because we are a level 4, the catchment area that we get from and the conditions of the moms that were coming in. And then on the flip side, we showed, I think we had transferred out in the last year 3 patients and why they were transferred out. One was a maternal choice, one was finally needing a transplant after she couldn't, and we don't have transplant services. So for the level 4, you need to have one of the 3 specialties, and it's fine if you don't have all of them as long as you have backup plans and can show. So that was our patient to show when we have someone that needs transplant services, what our process is for that as we go through. So yes, we had that data. And I think this helped us too to even solidify our maternal, maternal transfer and look for opportunities there. So now we have a group that meets every couple of weeks and reviews those and looks for opportunities for improvement with that.
Thank you
And
both.
they really do look to see if you have those transfer protocols and something in written and tangible and not just verbal.
Yeah, thanks, Bill. Is there anything else? My colleague Jennifer, is there any insights from you? Anything else you'd like to add? Just glad you were able to join us.
Sure, no problem. Yeah, I'm just really excited that the state of Florida has committed to this program in such a wonderful way. And I loved hearing from our colleagues who have already gone through the verification. I think, that's how I feel when I leave an organization, smiles and happy, especially after seeing such great practices. But to know that the organization's feeling that way as well after being verified at the appropriate level, I just think it's such an important initiative, and so glad to see the state of Florida embracing it in the way that they are. And anything that we can do to help, please let us know. This has been my baby for the last couple of years. I was part of the team that worked so closely with ACOG to develop the standards and the requirements for Joint Commission. And I just am thrilled to see it being so widely accepted and hearing that it's going really well. So thank you all so much.
We have one last question, Betsy. What are the 3 issues required for level 4? I don't know the basis of the 3 issues, but that was the question.
I think that may be from what Colleen mentioned, that you have to have 1, 3.
Correct. Sorry, I was typing in the chat. So there are different requirements and guidelines, and there's that you can compare to with the Joint Commission verification requirements. And so they're different by the levels. So for level 4, you have to have maternal or postpartum services for the patient with either cardiac surgery, neurosurgery, or transplant services, along with other requirements for the level 4. But you have to have one of the one of the three of those for that level.
Hope that answers your question, Karen. We will be, this is recorded. We will be posting this on our website. We also will be sending it out by email to everybody who registered. We also have the executive summary of evaluation of the 13 hospitals. This was not done by us. We have an independent faculty member here at USF who conducted both paper surveys as well as interviews. And it's a powerful piece of information. We're here to make it simple and easy. We say it's positive. We have evidence to support that this is a good process. Just let us know how we can help you, and we'd be happy to talk through any issues that you're encountering. And we encourage you to talk it up among your peers, because at least our goal here at FPQC is that every hospital be willing to be verified. With that, we wish you the best of the day and look forward to hearing from you at some point soon. And thanks again to all of our speakers.